When you go to a hospital for a procedure, do you know how much it will cost? There's been a federal law on the books now for 2 years that's supposed to force hospitals to be transparent with pricing. But is it working? News 5 investigator Jonathan Walsh has been examining medical pricing transparency. Jonathan, it would seem to depend on who you ask about whether or not these hospitals are complying with the law.
Yeah, Rob, I mean, you get one answer from the hospitals, another answer from the consumer advocacy groups, and the Centers for Medicare and Medicaid Services that enforces the transparency laws gave us some, let's say, interesting answers. So let's just lay it all out for you so you can decide for yourself.
I get my vaccines from Cleveland Clinic for several things. I don't think I've ever gone to an outside location for a vaccine.
Brandy Spencer from Cleveland is on Medicare and got 2 doses of the shingles vaccine last fall at Cleveland Clinic.
It's a big deal when costs catch you off guard.
She was surprised because she says her mother, who's also on Medicare, got the shingles shots at a local pharmacy for about $100 total. However, because Brandy got the shots at the clinic, when she eventually got her bill, it was $1,000.
I'm literally paying 10 times more for the exact same shot from the exact same manufacturer.
Brandy says she wasn't sure how large the bill would be. She tells us price transparency is critical for avoiding big charges.
That's how people end up in the poorhouse. That's how people end up missing rent. That's how people have to give up medications and end up in a hospital.
You got to know the numbers. You need to know the prices.
Cynthia Fisher of PatientRightsAdvocate.org has been examining medical prices at hospitals since a transparency law went into effect in January of 2021.
There's no reason why we can't competitively see prices on what one carrier charges or what one hospital charges.
The law says hospitals are now required to provide clear, accessible pricing information online in 2 ways. 1, a comprehensive machine-readable file with all items and services, and 2, a display of shoppable services in a consumer-friendly format.
It's not hard to post your price. Goodness knows these hospitals get paid every day, and they bill knowing what the dollars and cents charges are.
However, according to Cynthia's group that looked at 2,000 of the 6,000 hospitals nationwide, it found only 24.5% were actually following the rules.
As long as hospitals and insurance companies keep prices hidden and prices in the dark, they can charge whatever they want.
Right here in Ohio, it was worse. PatientRightsAdvocate.org says only 18% were compliant. Numerous hospitals were not compliant in the Cleveland Clinic and University Hospital systems, according to the report. We asked the clinic and UH to be transparent and answer our questions on camera. Both declined, saying they are following the rules.
So, who's right? The hospitals or the watchdog group? We asked the feds, and that's where it got even weirder. As of February, the Centers for Medicare and Medicaid Services, CMS, told us that they handed out 500 warning notices to hospitals that were not compliant, but they only issued 2 fines. So just how seriously is CMS taking this?
Then, when we asked if Northeast Ohio hospitals were compliant, CMS issued a statement saying, in part, releasing the compliance and status of hospitals prematurely could identify hospitals that have already taken corrective actions.
So wait a minute. The very program that's supposed to ensure transparency can't be transparent enough to tell us who's compliant?
So there's a lot of discussion around this and a lot of what does this mean?
We asked health administrative expert from Purdue University, Cody Mullen, to take a look at Cleveland Clinic and UH Hospital's websites.
The machine readable file was buried. And frankly, I'd email you to say, do you know where these are?
He does say, for the consumer-friendly rules, there's good information from the hospitals, but consumers could benefit from additional details when certain levels of care are listed without explanations.
I couldn't tell you as a professor in this field the exact difference between a level 4 and a level 5.
Meanwhile, Cynthia's group gave us specific examples of why some Northeast Ohio hospitals were not compliant as of its study. Like insurance plan names were not correct, and high percentages of the letters NA were listed with no specific costs.
When hospitals and insurance companies show all of their prices, they will have to compete on quality and price.
On behalf of Brandy, we asked Cleveland Clinic why her shingle shots cost 10 times more than a local pharmacy. It explained the shots were given in a different setting, and there are different costs per access of points of care.
If someone has said the words $1,000, I don't care what vaccine it was, I would have immediately stopped and said, okay, let me call my insurance and go from there.
$1,000. Routine vaccines. Got it. CMS recently said it sampled 600 hospitals and 70% are compliant. But remember, that's a much smaller sampling than the 2,000 hospitals the Watchdog Group did. CMS does say it wants to be more standardized as far as the reporting of prices, better access to finding machine-readable files, like our expert just said, and it plans to take aggressive action and steps against hospitals not complying. We'll see.
The mission to get those percentages up
Yes.
continues. Jonathan, thank you.